Hello, my name is Untitled Chapter. For 16 years, I've been a type 2 diabetic. This is my life, my story. This is living with type 2 diabetes.
I was 16 years old when I got the call.
At first, I was surprised that I had fallen to this disease. I thought I would never be a diabetic. However, the longer that I thought about it, I started to realize that I had many of the symptoms that a diabetic would have. During months prior to my diagnosis, I experienced increased thirst, urination, and I became much more fatigued. After I had been diagnosed with type 2 diabetes, I called a meeting with my doctor to discuss my future. I went 2 days later and we discussed about diabetes. He told me that if I did not change my lifestyle immediately, that I would succumb to the worst that diabetes could throw at me. This included anything from loss of appendages to complete blindness. You could say that I was very frightened.
And here we have today, joining us to talk about type 2 diabetes, Dr. Juhao Lee, MD.
Type 2 diabetes is a disorder in which your pancreas, which is a part of your endocrine system, produces a substantial amount of insulin. However, the insulin, which binds to receptors on certain cells, does not affect the receptors as well. So in order to allow glucose to pass from within your bloodstream to within your cell, your body needs to produce more insulin. Approximately 25.8 million adults and children in the United States alone have type 2 diabetes. An estimated 1.9 million new cases are diagnosed every year in just the United States. Type 2 diabetes is usually a form of diabetes that occurs in adults over the age of 40 who are overweight or have a family history of diabetes. However, in recent years, it is shown that normally occurs in adults over the age of 40 who are obese or who have a family history of type 2 diabetes. But however, in recent years, studies have shown that an increasing number of younger people have been diagnosed with type 2 diabetes. Since insulin is not responsive to your cells, there comes a point in which your pancreas produces insulin and so much insulin, and your cells keep on not responding. So there also comes to a point where your pancreas just quits completely and does not produce insulin at all.
Here we have a flowchart of a healthy human body and a human body that has type 2 diabetes. The process begins when food is consumed. It travels down the esophagus and the digestive tract sends a signal to the hypothalamus, a region of the thalamus which is part of the larger brain. The brain sends HGH, human growth hormone, to stimulate the beta cells, which are located in the pancreas, to create the hormone insulin. Insulin then travels through the bloodstream and binds to the receptor. The receptor sends a signal down to the nucleus, which sends a signal back to the receptor protein, or GLUT4, which then allows glucose to enter the cell. This is a healthy human body. However, in a body that has type 2 diabetes, everything up to this point remains the same, except the insulin traveling through the bloodstream, when it binds to the to the receptor, there is no reaction. Nothing happens, no signal is sent to the nucleus, and therefore nothing is sent in return. Therefore, glucose cannot enter the cell and remains outside, and the insulin basically remains utterly inert. So what happens is you have an overcharge of glucose inside the bloodstream and too little glucose inside the cell. And joining us today is our very own DO, Dr. Alan Tan.
Hello, I'm the court-appointed dietitian that is going to be taking care of Jonas Liptak. He is a type 2 diabetic, and type 2 diabetics, their diet should really consist of proteins, fibers, omega fats, and complex carbohydrates. Proteins can be found from beans, meats, or eggs. Fibers can be found in fruit or vegetables, and today we have guavas. Yum yum. Omega fats can be found in seafood, or you can go the easy way and take pills. And complex carbohydrates can be found in brown rice or whole grain foods. And type 2 diabetics should really be careful and wary of saturated fats and glucose. Because saturated fats, butter, is really unhealthy for a type 2 diabetic, because usually type 2 diabetics are overweight people. And glucose, well, of course, if you have insulin resistance, why would you want more glucose in your system? Doesn't make sense. So Jonas, you got that all down?
Oh, yes, sir.
Wow, Oreos, my favorite. Wait, double stuffed Oreos. Even better. Hey look, Diet Pepsi. At least it's a little bit healthy, right?
No. Soda in general is really, really bad for you.
Who cares? You have to buy 4.
You should probably get some of this.
No. Turn away. I have to cook it. I don't want to cook it.
As a type 2 diabetic, it is important for you to 1. Maintain a healthy diet, 2. Consume your medication, and 3. Get plenty of exercise. Exercise helps you control your condition. It improves your body's use of insulin, decreases and controls your weight, increases bone density and strength, lowers blood pressure, lowers bad cholesterol and raises good cholesterol in your bloodstream, and increases your energy level. When you exercise, here are a few tips to keep in mind. Number 1, don't push yourself too much. Prolonged and strenuous exercise causes a lot of hormones to be produced, such as adrenaline. These hormones counteract the effects of insulin in your body and will increase your blood sugar level. Number 2, make sure you drink plenty of water. If you don't drink water, you'll get dehydrated. And lastly, make sure you get at least 150 minutes of exercise a week and spread it out throughout the week. Make sure you do not go more than 2 days without exercise.
Hello, my name is Dr. Lee, and I am a nutritionist. So if you already know what a nutritionist does and you're interested in becoming a nutritionist, you must first get a high school diploma, of course, and then when you go to college, you need a bachelor's degree. And when you go to college, the courses are recommended but not limited to nutrition, physiology, biology, and chemistry. And to become a nutritionist, you also need several hours of training, supervised training. And what a nutritionist does is that we get a patient's progress report, or we get a patient's medical data, and judging based on that data, we develop a meal plan for them that's cost effective, that's within their budget, and we also note their preferences so the meal doesn't taste bad to them. This process is enjoyable for them. And we also sit down with large groups of people or with single individuals to talk about the effects that your diet have on your health. We talk about how good diet habits can lead to positive effects and how your diet can manage or prevent certain diseases such as hypertension, atherosclerosis, and of course diabetes. And that's basically
That night I thought to myself, and I knew I had to make a decision. Risk the consequences and living unhealthy, or start exercising and counting my calories. I decided that I would choose the healthy path.